Hello and welcome. This video is an introduction and overview of E1MN. The slide shows the E1MN logo and the state of Minnesota logo. Let's get started. E1MN, a state agency partnership advancing employment first. E1MN is an unprecedented collaboration between Department of Human Services, Disability Services Division, the Minnesota Department of Education, and the Department of Employment and Economic Development, State Services for the Blind, and Vocational Rehabilitation. Our mission is to work together to deliver a more seamless and timely employment support system for people with disabilities. We want people to be able to get the services they need when they need them. Our shared vision. On the slide, we see the E1MN logo. What fuels our work together is our shared vision, which is we will work together to align our systems so that our common customers get seamless and timely supports to make informed choices and meet competitive, integrated employment goals. Whether it is a person who can't yet envision competitive work to the person who has a clear work goal, we want to create a better experience. It is important to emphasize that E1MN is not a new service, not a new program, or even a project. Rather, it is a new way of thinking and working together for all of us at the state level and at the local level to make things work better for people, which ultimately makes things work better for all of us. When you see the E1MN logo, you know it signifies shared messaging, agreements, and training we all are receiving across the system, so we are on the same page working as a coordinated system. Why is E1MN needed? Employment supports for people on waivers span across multiple agencies, but are not aligned. This has made it complicated and confusing for all involved and has led to some inconsistent practices. We are not meeting our Olmsted goals. We have made some progress, but we need to do better, and we do better when we work together. E1MN renews our commitments and focus to tackle the barriers holding us back. We want to make it easier for people to realize their capabilities and meet their goals. Ultimately, we all want to do better for the people we serve. A resounding message we heard from DHS, DEED, and MDE, and from stakeholders is a commitment to change. From everyone we engaged, we were inspired by the messages and willingness to try and to work differently. Finally, federal policy directs our system to work together. While the policy directs a memorandum of understanding with one another, E1MN conveys a much stronger commitment to operating as one statewide system coming together behind the scenes to build better experiences and outcomes for people. We now have clear federal direction and need to align our work accordingly. Here are our key strategies. First, we will plan and improve coordinated services and employment-first approaches. We are committed to using person-centered tools and practices to help create a common language and experience for our shared customers. We will also work to remove barriers and confusion, making it easier for people to navigate the system. We know this work will take time and that it will be continuous. We will work with local and culturally specific partners to improve access and equity. We want to expand our provider network to build dual providers across the state, providers who represent the diverse makeup of our program participants and are available in their own communities. We will support each other and bring out the best our agencies have to offer. We are better when we work together and lean on each other's strengths. E1MN foundational work. To make sure E1MN works as smoothly as possible, committees, stakeholders, and work groups tackle a number of issues like service sequencing. We've been working to clarify the sequence of services for youth in school and adults out of school to clarify who pays for what, when. We want to emphasize that this is not a change in law or policy, but a clarification in process and how DHS and DEED work together. We're also clarifying how referrals and transitions will be made between programs to ensure a more seamless delivery of services and supports. We want people to receive the services they need when they need them. It's important for waiver case managers, employment service providers, and VRS SSB staff to know when referrals and transitions need to happen, their role in making the referral or transition, and how to make those referrals and transitions. We've also been working on provider alignment. We're encouraging a shared network of providers to improve access and smoother transitions. We offer training for support professionals. Recordings of past trainings and webinars can be found on the E1MN Trainings and Events page of the Disability Hub MN website in the Work Toolkit. As part of this work, we are building tools and resources that you all as support professionals can use. They will be helpful for all of us to build a common practices and support the process. Some of you may have similar tools that you currently use, and you can continue using them. This wraps up the E1MN introduction and overview section. Thanks for joining us.